All right. Good morning, Dr. Katzen.
Good morning. How are you?
Good. Happy Taco Tuesday.
Happy Taco Tuesday.
How are you doing today?
Good. I haven't had any tacos yet, though. Too early.
Too. Oh,
Is it too early for tacos?
I don't think it's ever too early.
Okay.
As long as it's Tuesday.
All right.
All right. So it's just going to let people know to start coming in. Hi, plastic surgery. Thanks for being the first ones in.
All right. First one's in the door. Yay. So today we're going to be talking about arm lifts, or more technically, arm reductions. Medical terminology for that is a brachioplasty. It's basically making the arms smaller.
All right. So brachioplasty, arm lift, arm reduction.
Pretty much all the same thing.
We're going to be watching a video together. This is one of your surgeries that you did 9 months ago.
Yep.
Alrighty. So let's just get right into it.
All right. So this is up on YouTube. You can watch it later or with us or whatever you want to do. And we're just going to click play here and run through the arm. So this is the before, excess skin and fat in the upper third, middle third, and lower third.
A very nice patient in her late 30s. She has arms that bother her. And specifically, we have excess skin and fat in this proximal 1/3 to 1/2 of the arm. And this type of arm is due mostly to genetics. Her mom had these arms,
So a 39-year-old female, 5'1", 175 pounds, 170 pounds. She lost about 40 pounds, 40.
Mom had these arms, and we have a lot of excess skin and fat right here. So what we're going to be doing is a brachioplasty to reduce and reshape the arms by getting rid of the fat in the arms as well as the skin. So if you just did liposuction here, you should have a lot of hanging skin. So you got to remove the skin. So I'm going to make an incision.
So this is a skin problem and a fat problem. So if you just remove the fat, she's going to have hanging skin for sure because she lost 40 pounds. If you just remove the skin, she's going to have a lot of excess fat. So you got to remove skin and fat.
Goes from here to about here. Reassess the arm, see how much we can get. And then if we have to, we may have to carry it out to the elbow to get her a nice skinny arm. So let's go to the operating room and I'll show you how we do, ideally, a limited incision, brachioplasty, or arm lift, arm reduction. So we're in the OR now, and we're going to do a brachioplasty, which is an arm reduction, arm lift. We're going to do lipo first.
So there are a lot of medical studies that show that you can do liposuction on the arm and get very good, successful results. It's been repeated in the medical literature that you can do this safely without jeopardizing the final result. A lot of plastic surgeons, excuse me, losing my voice a little bit. A lot of plastic surgeons will not do liposuction, not get good results because they fear that the incision may break down. But don't worry, you can do liposuction when you do the arm lift and the arm reduction. So what I did is I did 2 little incisions, one here at the elbow, one in the middle of the arm, and that allows access with the liposuction cannula to the entirety of the arm. So when you do liposuction, the best way to do it is you put in fluid, namely tumescent solution. Tumescent solution has lidocaine in it and epinephrine. Lidocaine minimizes the pain during surgery and after the surgery. Epinephrine minimizes the bleeding during the surgery.
Don't need nobody else. Yeah, I can save myself. Got burned, but I learned. Our scars make us who we are. Now I'm 10 feet tall over my demons. Remind me no one's got me like myself.
So when you do liposuction from the elbow, that pretty much gets the middle third and the third next to the armpit, but it's hard to get that area around the elbow if you're liposuctioning from the elbow. So from the center incision here in this middle third, you're able to go back towards the elbow and get that pocket of fat around the elbow. A lot of patients don't like when their arm is fully extended, that area of skin and fat that hangs over the elbow and covers the elbow. That bothers a lot of patients.
I love me without any help. I'm the best thing to believe in. So I'm bringing up the flame, yeah, bringing on the lightning.
Now I've started my incision. Again, I made my incision from the armpit out to the elbow, and now we're dissecting through skin and fat.
So we're continuing with our brachioplasty. We did the liposuction. I made my incision, and I determined that she'll get the best result by a longer incision from the armpit out to the axilla. I spoke to the patient pre-operatively, extensively, that this might happen to get her best results. So that's what we're doing. Now I'm dissecting straight down till I bump into the pocket of liposuction that we encountered and did. You see I just entered?
And you can see this is just a regular dissection, but once we get into the pocket where I removed all that fat, you're going to see it gets a lot more clear because it's been evacuated or removed of fat.
Right there, that's from my liposuction. Without liposuction, you don't have this pocket and you don't get as good a result. I've done hundreds and hundreds of arm lifts. I do a fair number of other people's mistakes and revisions. Usually the problem with the revision is that liposuction was not done. So if you're gonna have an arm reduction, I think liposuction is an essential component of that. So now you can see my left index finger here is sliding into the pocket of where I did lipo. It's a pretty easy dissection.
So if you didn't do lipo, you wouldn't have this pocket, and it's not as easy to do the surgery, and you don't get as good results. So you really should do liposuction with the arm.
Just straight down the fascia of the inner arm here.
Always used to let you clean up the messes down on my knees, but I couldn't stand up on my own. Turns out sometimes you're stronger alone.
So this is that pocket, that cavity that the liposuction affords. It allows nice clean dissection and allows us to rotate the skin up and get out a lot more skin than you would have been able to resect if you had not done liposuction.
Bringing up the fight, yeah, bring on all the lightning, 'cause I'm looking for it.
I'm measuring how much skin and fat I can remove. So I put my top clamps on the front. This is the baseline. This line doesn't move. I'm not going that way anymore. But on this bottom line, I can resect at will. So I'm going to take out more skin and fat.
Yeah, I can save my.
So for you surgeons watching out there, this upper line is the FICS line. So when you're sort of doing like a tummy tuck, that bottom incision, it doesn't move. So that incision on the top doesn't move, but the one on the bottom, you can take less tissue, you can take more tissue. So that's what's called the variable line. So you can adjust that line with the towel clamps, determining how much skin and fat you want to resect.
Dr. Katzen, someone asked, what if you have loose skin on your forearm? Is there something to address this?
Yeah, so we take that incision from the elbow all the way down to the wrist. Okay, so that's called a forearm lift, forearm reduction. So the only way to get rid of that excess skin is with an incision or excision of skin. And we often combine the forearm lift with the upper arm.
I predict I can take out maybe to about there. So we'll see here in a minute. Now I use 7 towel clamps.
Remind me no one's got me like myself. Yeah, I love me without any help. I'm the best thing to believe in. So I'm bringing up the fight, yeah, bring on all the lightning. 'Cause I'm looking for a hero. Look inside the mirror. I found one. Oh, carry the hurt when it gets too hard. Pick it up, dust it off, and I fall down 11. I get up 12, don't need nobody else. Yeah, I can save myself. I could crumble into pieces, but I got a million reasons why I won't. 'Cause this
I'm getting rid of the dog ear in the armpit by extending this incision sort of like that. She's going to lose some armpit hair.
So if I were to just bring the incision up to the corner there, you should have a lot of excess skin and fat here. Looks like a dog ear, that's why we call it a dog ear. But to get rid of that dog ear, we extend that incision a little bit further that way, and you'll see me do the same thing at the elbow.
You're going to lose some sweat glands, but no lymph nodes. And that's to eliminate that dog ear right in there.
Sometimes it's hard to get out of it.
On some patients, to eliminate the dog ear, we go clear down the side of the chest.
And that addresses the bra strap roll.
Yes and no. The primary reason to extend the incision down is to get rid of the dog ear. If you want to get rid of the bra strap roll, different procedure, that's a torsoplasty, but we can do that too, often done together.
Dark, I was just trying to feel something, falling asleep to the sound of it. Always used to let you clean up the messes down on my knees, but I couldn't stand up on my own. Turns out sometimes you're stronger alone.
So there's the specimen.
Yeah, bring on all the lightning.
So what we do is we just come to the elbow in.
So now I've raised the elbow up like that, nice and straight. So I'm getting rid of the dog ear here at the elbow. Remember, we got rid of the dog ear in the armpit. Now we're doing the elbow. So there's the tip of the elbow right there. And now I'm coming behind the elbow. So that gets rid of that overhang. And it also lifts a little bit of that forearm up. A little bit.
Get rid of this excess skin and fat right here. Gotta be careful, there's some major nerves here. You don't want to get into those.
Pick it up, dust it off. When I fall down 11, I get up 12. Don't need nobody else. Yeah, I can save myself. Got
So that's the dog ear at the elbow.
burned, but I
I finished the arm now. It's much, much smaller. I'll measure it right at the end. And now I'm just going to suture it up with absorbable sutures from the end to the armpit.
Okay, and we're just gonna do the
I'm
other
just going
side.
to do the same thing on the other side.
So I'm just gonna mute it and let it keep playing, and then a lot of people have questions, so
Okay.
I'll just give them to you now.
All right.
Okay.
So question time.
Let's see. Someone was asking if you do mini arm lifts and those are beneficial.
Yeah, it depends on the patient. Sure. This is not the only type of arm lift. There is from the beginning, these are high def arm liposuction where we sculpt the arm and hope the skin bounces back. We can do that with Renuvion. We can also make a little crescent incision in the armpit, but if you did a crescent incision on this patient, she would not get a good result. Crescent arm lifts really don't give great results because it's only removing a little bit of skin. Yeah, the scar is hidden, but if you're not going to get a great result, why even have a hidden scar? So there's the crescent incision, there's the mini T incision where I make an incision in the armpit and go partially down the inner arm. There's another modified incision where I go from the armpit partially down the arm. There's another incision as we did here from the armpit to the elbow. And then there's the ultimate where we go from the armpit to the elbow to the wrist.
All right.
So there are 5 different types of arm lifts that I do.
Why are no drains needed for arm lifts?
You don't need them because there's not much fluid that comes out. I noticed that early on I'd put drains in, this is like 20 years ago, and not much fluid would come out. We'd get the drain out maybe at day number 2 or 3 because there's not much fluid. So the way I do it, you just don't need drains. You can put drains in, but you don't need them.
All right. Someone said they're a little worried about recovery and what they need and who they need to help them.
Yeah, so I would suggest plan on a 2-week recovery. The recovery is we want your elbows straight and your hands above your heart, like that kind of position. So you're going to need some help probably for maybe about, I'd say 3 to 5 days, getting you up from the bed to the bathroom, up from the bed maybe to the dining room table, stuff like that. You're going to need a little help feeding yourself, brushing your teeth, brushing your hair, things like that for about 3 to 5 days.
Okay, and we're seeing on the video that you went from 43 centimeters to 35 centimeters.
Yeah, so that's pretty good. I mean, it's about like that down to about like that. So every patient's different. And the limit of the arm lift depends on the underlying structures. So if you have big biceps and big triceps, well, we're not going to take out muscle in cases like this. So you're going to be limited by the circumference of those muscles underneath.
All right. Someone's asking how they can ask their arms, or how they can expect their arms to look as they heal.
Kind of a vague question, but the results that you see on the table are not your final results. It takes about 2 years for the scar to mature and heal and the swelling to go down. So it's a continuum. Basically, you know, what you see is not what you get. Basically, the scar, the healing just goes through time. Swelling goes down. The scar fades and fades with time. So to minimize your scarring, 1, you'll wear compression garments. 2, you'll apply silicone cream when everything is healed, and I like the silicone strips to really minimize the scarring. And then if the scarring is still prohibitive, there are other things we can do. Microneedling, steroid injection, Fraxel laser, things like that.
Have you ever seen patients of yours that you could barely notice the scar on their arm?
Sure, often. So one of the reasons why we place the incision from the armpit to the elbow is because when your arm is down by your side, as most humans naturally carry it, check yourself right now, I bet your arms are down by your sides. And when you're, no. So your arms are down by your sides, so that scar is usually concealed. If you put the scar on the back of the arm from the elbow to the armpit, as I've often seen a lot of general surgeons do because it's a lot easier, when your arm is down back like this, you see that scar pretty obviously on the back of the arm. So that's why I don't like to position the arm. I don't like to position the scar on the back of the arm like that.
Let's see. Riri Strong is asking how long do you recommend waiting between surgeries, for example, tummy tuck and arm lift?
Tummy tuck and arm lift, I'd probably give yourself at least maybe about a month to 6 weeks. It allows your bone marrow to crank out new blood cells and for you to heal. Also, you got to realize that, you know, if you have had a tummy tuck and you're going to go embark upon your arm lift, you're going to be relying about using your core muscles to get you up and out of bed because your arms are going to be wiped out. So about 4 to 6 weeks is the optimal time.
Have you seen those two procedures done together?
Yeah, we often do the arm lift and the tummy tuck at the same time, but the patients need to realize to get out of bed to the bathroom, you're going to need some help because you're not going to be able to use your arms to pull yourself up, and you're going to need somebody to help you get from the bed to the bathroom. Another really good thing to help you recover from a procedure like a tummy tuck and combined arm lift is one of those recliners with the power ejector button. You push the button, it takes you from a sitting position to a standing position. You don't need any help.
All right, media CEO is saying, do you have any before and after photos I could see for this procedure?
Yeah, we have about 180 patients, so that calculates out to about 360 arms. You can check them out on my website. We put everything on our website, so go check out our website.
Riri's asking, how long do I have to wear a compression garment for?
I like 6 weeks. 6 weeks allows the opportune time for the swelling to go down and it helps to flatten the scar. And we like the arm garments that pretty much go from the middle of the forearm for these types of arm lifts, pretty much all the way up to the armpit. I don't put the garments on right away because I think it's too much compression, and I think it's very difficult taking that garment on and off in the acute setting. But usually we start the arm garments at about maybe 2 or 3 weeks after the surgery, so that allows that incision to heal up pretty well.
All right, Emily's asking, when can I lift weights again?
It really depends on the patient and the healing and how everything is going, but usually it's going to be about 4 to 6 weeks after the surgery.
All right. We already covered what are the different types of arm lifts. Joey's asking, is it okay to do a high five on the day of surgery?
Yeah, it's okay to do a high five on the day of surgery before your surgery, not after your surgery.
And Joey said, can you raise your hands in the air like you just don't care if you're a fan of hip-hop music?
Yes, I guess you can.
All right. Let's see. Someone said, do you use GS Surgia plastic surgery instruments?
No.
No. Okay. Someone's asking, should you be at your lowest weight when doing this procedure?
Yeah, ideally, yes. Now, there are a couple of different types of patients. My most common patient are weight loss patients, lost 100 pounds or more, a lot of excess skin and fat of the upper arms, and those are the primary cases we do. However, we do have a subset, a minority of patients who have what we call genetic arms. Look, my mom had these arms, my grandma had these arms, my aunt has these arms, everybody in my family has these arms. And they're larger arms with excess skin and fat, and for those patients, we'll typically do an arm lift like that. So the majority of my patients, weight loss patients, but we do have a subset which have what we call genetic arms, genetically big arms.
All right, people are laughing at the high five and the waving your arms in the air like you just don't care. Someone's asking, do you use Bridgets for scar healing?
I'm not quite sure what Bridgets are.
I'm not sure what that is either.
What are Bridgets?
All right.
I think maybe they're alluding to tape, but again, it's a brand name that I'm unfamiliar with. Basically, I don't like adhesives or tape on my patients because all tapes, all adhesives, no matter what they are, do cause blisters. So we'll get these perfectly well-healed scars, and the patient will literally put a Band-Aid or a steri-strip on it and get these horrible blisters on either side of the scar, and those lead to permanent scars. So they got a great surgical scar, but it's the adhesive and the tape they put around it that destroys and causes blisters and permanent bad scarring.
All right. Rudy said, TK is one gifted man.
Thank you. Thank you. I assume that you're referring to me, Tim Katzen.
All right. Media CEO said, do you perform them in a hospital or do you have a surgical facility?
We have surgical facilities. Of course, we can perform these in the hospital, but the reason that I like the Surgery Center, it's a little bit faster, quicker. We have my team, and also you avoid the bustle of the hospital. Hospitals still, have contaminated rooms with MRSA, an antibiotic-resistant organism, as well as some still COVID cases and sick patients. So we can offload the caseload from hospitals by doing these safely in a surgery center. These are done under general anesthesia with a board-certified MD anesthesiologist with us.
Someone's asking if there's a teaching hospital that you give lessons at.
No, I don't, but we do a lot of teaching in the surgery centers.
All right. Someone said they didn't know that about adhesives and the breakdown of scars.
So all of our consent form will have the patient acknowledge that we don't want them to use any tape whatsoever on their skin because it's going to cause a blister. So if you're out there and you're planning to have surgery, whether you're a weight loss patient or otherwise, I would try to avoid as much tape as possible.
Is the arm lift procedure considered a painful recovery?
It's relative. You know, if you've never had surgery before and this is the only surgery you're going to have or have had, yeah, it's probably going to be painful because you have nothing to compare it to. But for the majority of my patients who I perform tummy tucks, body lifts, thigh lifts, face lifts, back lifts, torsoplasties, everything like that, this is one of the less or least painful procedures.
And how do you handle pain after surgery?
Yeah, so everybody's different. I've had patients undergo this surgery and only take Tylenol. I've had some patients who take stronger medications. We will prescribe Percocet. We will prescribe Flexeril, which is a muscle relaxant. And a lot of the times we'll also try to insert a pain pump, which is going to drip in lidocaine and numb up that area for like a good 5 days.
All right, someone's asking, how do you apply pressure if you're not able to use tape to your arms? Is it ace bandage?
Yeah, it's ace bandage and compression garment. So the tape really doesn't apply any pressure to the incision. It may provide a little support to the tissue, but it's really not worth it. I've done hundreds and hundreds of these arm lifts without any tape. You do not need tape. For the initial garment, we have you in an ace bandage that goes from the armpit to the elbow, and then after about 2 or 3 weeks, then we get you in a formal arm garment for about 6 weeks.
All right. And how do we avoid complications after the arm lift?
Avoid complications. Not too much activity. You know, we don't really want you bending your arm. We don't want you really brushing your teeth for about 3 to 5 days. When you have to get some help on that, or maybe use Listerine, scope, etc., something like that. But we really don't want you bending your arms. We also want your arms up to minimize the swelling in the hands, because swelling in the hands slows down the healing. And then follow your plastic surgeon's sort of recommended procedure, but I usually wait about 2 weeks before I get you in an arm garment. So those are the main things: is the swelling, keeping your elbows straight, minimize infection, minimize any dressings, garments, ace bandages, rubbing in the armpit, because sometimes the abrasion of the garment in the armpit can open up that wound. In the armpit, you got hair follicles and sweat glands and lymph nodes, and you got that, sometimes that garment or that ace bandage digging into that area. So a lot of the time the armpit opens up a little bit or a lot depending on the type of wound and incision.
All right, so we have about 5 more minutes, so please get your final questions in. Someone's asking, do you use absorbable sutures?
Yeah, so for the arm lifts, we use multiple dissolvable sutures. There's some short-term sutures that we use, which usually dissolve at about 4 to 5 months, and then the longer-lasting absorbable sutures, which dissolve maybe at about 8 months. But all these on the arm are dissolvable sutures.
All right, so we'll take your final questions. Please be sure to follow us on our main account. We'll comment below on our main account.
And check out our website for all these pictures. Go on YouTube. You can Google my name or just Google up arm reductions, arm lift, and you should see a lot of these videos that we create.
Yeah, so we have tons of before and after pictures, tons of videos.
Tons.
So many. Please go watch them.
Yeah.
Give them a like. Subscribe to us on YouTube. Someone's asking, how long is recovery?
So again, recovery is about maybe 2 weeks, depends on your job, okay? So if you have a sit-down clerical data entry kind of work, maybe you can return to work in about 2 weeks. Finger exercise, data entry, keyboard is actually good for the healing. It minimizes the swelling. However, if you work at like maybe a hardware store where you're lifting like bags of cement and soil, maybe give yourself about 3 or 4 weeks to return to work. If you're like in the medical field and you may have to code a patient or move patients in the hospital, plan on taking off maybe about 3 or 4 weeks because that's more of a demanding type of job.
Media CEO said you're the best, Dr. Katzen.
Oh,
thanks for
thanks.
answering our questions.
Sure. Thanks for watching.
Yes, thank you guys. Thank you for joining us on this beautiful Taco Tuesday.
Taco Tuesday.
What kind of tacos do you think you'll have today?
Ooh, probably carne asada, I think.
Carne asada. Is that your favorite?
I like the shredded pork too.
Mm-hmm.
Yeah, birria is pretty good too.
Oh, yeah.
And then the goat, the chiba is really good.
Yeah. Are there any good taco places
And
near you?
fish tacos.
Fish tacos?
Awesome.
Fried fish tacos?
Fried fish tacos, yeah.
Yeah. Someone said they're going to have al pastor today.
Oh, al pastor is very good.
That sounds very good.
Yeah.
Oh.
I can't think of a bad taco. You know, think about it.
Hmm.
I saw a cool device. A guy was eating a taco, and it's got like a little funnel, and at the bottom of the funnel is a hole, and underneath there's another little taco wrapper. So as he's eating the taco, all the little bits fall out, and they fall into the next taco that he's making. I thought that was a genius idea.
Oh yeah, that is good.
Everyone get one of those.
I like to eat tacos with gloves because you know how it gets so
Yeah,
crazy.
I could see that.
All
I'm wearing
right.
gloves all the time, so I prefer not.
All right. Well, thank you guys so much for joining us. Oh, someone said Taco Tuesdays with Dr. Katzen. Yep.
Yay.
Absolutely. Let's see. Someone said, how long do you recommend wearing pressure garments, if any?
Yeah, about 6 weeks. 6 weeks is ideal. You can wear them longer, but minimum 6 weeks. It helps with the swelling, and it really helps with the scar.
All right. Thank you, Chris. He said using gloves is a very clever idea. People look at you a little funny, and if you don't have gloves, then you could also use the little plastic bags you put the lines in. They work just as well. All right, and I think those are all the questions. People are still joining us, but we're gonna have to leave.
Yeah.
Actually, the procedure that's on the TV is brachioplasty, arm lift, arm reduction.
Yeah, so if you just go on to YouTube, do arm reduction, arm lift, you'll get this video. Medical term is brachioplasty, BRACHIO plasty, but it's basically making the arm smaller.
Alrighty, and if you see that comment that says, please follow our main account here, please click that and follow us at Dr. Katzen MD. That is the account that we
Please.
post on every single day. And when we're allowed to go live on there, we'll go live again.
Yep.
Alrighty. Thank you so much. Thank you guys for joining us today.
Thank you very much, and we'll see you next Tuesday live, and if not, sooner in the operating room.
Alrighty. Bye-bye.
Okay, bye-bye.
Okay, good. That's done. And then, bye, YouTube. Thank you so much for
Bye,
joining
YouTube.
us today. Let's see. Oh, one person's asking, how long does it take for your nerves to get back to normal after surgery?
Usually about maybe 2 weeks. And again, it may be a little bit of swelling that contributes to the numbness in the hand and the forearm. But usually that swelling goes down after about 2 weeks and the sensation returns to normal.
All right, Kayana. Thank you for your question. And we'll see you guys later.